Let's talk a little bit about what is passive and active insufficiency. I know that this is a concept that's a little bit difficult to wrap your mind around at first, but once you get it, I think that it's going to just stick with you for a long time. So we need a muscle group or muscles, or just one muscle, that crosses over two joints. I think the best example that I can demonstrate right now is the flexors of the forearm, like that do this motion. Also can flex the elbow because most of them originate at the medial epicondyle of the humerus. And the extensors of the forearm, which extend the wrist, extend the digits, and extend the elbow. They originate at the lateral epicondyle of the humerus. Well, remember a long time ago you learned about sarcomeres and muscle ratcheting? Well, these sarcomeres, they have these little ratchets that pull together. When we get to a point that we cannot move our muscles into, say, a more elongated position like this. So these would be my flexors. Notice now my elbow's at 0 degrees here. My wrist is extended as it can get, and then my fingers are as well, right? So when this is going on, I can't go anymore. The contraction cannot stretch anymore. It can't eccentrically contract. So at this point, this is called passive insufficiency. The other thing that you're going to notice in a point of passive insufficiency is that you're not going to be able to grab anything without starting to compensate, starting to flex, because those sarcomeres, they can't go any longer than that, right? So now you're having these flexors. Well, the exact opposite motion, the one that is the antagonist motion, that's say right now, if you're going into full extension, the flexors would be the antagonist actually. So the muscle that is the agonist, let's say now the flexors, they're going to go into a flex position, totally flexed. And you can try this in a second. So they're going to go all the way into this flex position. Well, now the extensors are at a point of passive insufficiency. And guess what's happening now? Our flexors are actively insufficient. So they can't flex anymore. In fact, if you try this with your own hand, take your hand and make a fist. Now, slowly bring your elbow into flexion. Now, try to flex your wrist. And you'll notice that your fingers kind of pop out. Watch mine. I'm going to get a lot closer. So I'm going to put my arm to full, here I am, full passive insufficiency. Now, I'm going to go into active insufficiency. I can still make a fist, Oh, my fingers are starting to lose it a little bit. And try it on yourself, because our muscles cannot handle any more pull. In fact, another way that I can show you active insufficiency and passive insufficiency is if I take a rubber band. So if I'm with this TheraBand, I'm putting it right at the medial epicondyle of the humerus, and I'm wrapping it around my wrist. So you'll notice that this is pretty tight. And now I'm going to be just with them at a normal, okay, so that's a normal muscle tension, right? In this normal muscle tension, we can lift a lot more than if we're at a point of passive insufficiency, and then I'll go through active again. So now this is really tight. They can't go anymore. The sarcomeres are going to do nothing because they're really elongated. And the next thing that can happen is some wear and tear and a little rupture of a tendon or so. Or muscle stretching. So repetitive motions in that position of passive insufficiency mostly passive, cause a lot of difficulty with some tendon difficulties, tendon ruptures, just tiny tears, and then creates scar tissue. So now I'm going to demonstrate The extensors at a point of, right, if they're here and you're fully flexed in, the extensors are a point of passive insufficiency. Sorry. So now I'm going to bring them into active insufficiency. I'm going to bring my arm up, and then my wrist is extended. Now my elbow is extended. And you can try to make a fist again with this. And notice now my wrist, so funny, but my wrist starts coming down. So I'm going to try to make my wrist extended. Now I'm going to try to make a fist, and notice this loss of range of motion on my wrist. So we know what agonist is, and that's the main muscle group that moves things, or the main muscle. Antagonist is the opposing muscle force, the one that is doing the opposite. So flexors are the agonist here. Extensors are the antagonist here. And what they're doing is they're causing like a balance in tension, muscle tension. You don't have like all one group of muscles working at one time and the other one's just not doing anything. So they're also performing these contractions, right? So now I'm going to get into concentric and eccentric contractions. Concentric contraction is when the muscle is doing what it's supposed to do. The agonist is working, it's flexing, that's concentric. However, these guys, the antagonists, and you could feel it on your arm, they're performing a contraction too. They're performing an eccentric contraction at that point. So they're elongating as they're getting stronger. Concentrics are shortening as they're getting stronger. I hope that was helpful. Another whole activity we could talk about is you can grab anything like a ball, something like try to make your hand really grip something. So I'm going to just grab this. And now you're going to put your flexors in a point of passive insufficiency and see how far you can get your wrist back. See, I need what we call this tenodesis kind of movement, where now we're flowing naturally. Our fingers back and forth, they naturally go into our palm, but they do that because the muscle cannot either elongate or shorten anymore. And so it needs a little slack around those joints. And so we have to close our fingers or open our fingers. So grabbing on, performing like a concentric contraction of your flexors. And now try to do it all the way forward. Ugh, it's so painful. So when you take a tool that's called a goniometer, which is goniometer is measurement of range of motion, you can see when that passive range of motion, when you're passively insufficient, if you start to squeeze, you lose some of that with the goniometer or that measurement. And then there is a strength measurer that's called a dynamometer. And when you're in a point of passive insufficiency, you'll lose a ton of your grip strength. I hope this is helpful. It's not just the flexors and the extensors. You can do that to the biceps and triceps. Also the hamstrings and the quadriceps all have these same exact things happening. It's that counter muscle balance. So it really doesn't involve as much like we were always talking about what are the synergist muscles, or what are the muscles that are helper muscles to our main and agonist muscles, not the antagonists, the agonists. So these are more focused on the antagonist and the agonist muscle. Are they passively insufficient, actively insufficient? The other thing that's really important is that people work out and they lift things and they put their bodies in positions that really we like our muscles to be at like our 20% to 80%, and that's even losing some strength of the length, you know, in between that, to be that sweet spot to get the working out and or lifting things, keeping our body mechanics really amazing as we get older, and basically when we're young as well. If we can start teaching those tools, they won't have injuries to their back or spine, or really develop good mindful body mechanics. As occupational therapists, what we would want to do is look at, are our patients lifting in a way that's causing their body mechanics to be really out of whack. So are they functional anymore? How can we get them to know how to lift in that 20 to 80% range? And really, if we can keep it like a little bit more like 30, that's a better lifting. So I hope this is all very helpful. So we went through today passive insufficiency, active insufficiency, agonist, antagonist, eccentric contraction getting longer, right? A contraction getting longer. Concentric contraction, a contraction getting shorter. It's the one that we talk about all the time, right? That when we're focused on our muscle origin and insertion, we talk about the concentric contraction that it makes. So anyway, I think that I covered all of the main terms that you'll be needing. If you need anything, just let me know. Okay, bye-bye.